So let's talk about some practical aspects with breastfeeding. First of all, I want to talk about some resources. Most hospitals nowadays have something called a lactation consultant, which is a nurse that specializes in helping women breastfeed right after having the baby. So if you're going to breastfeed your baby, make sure you let your nurse know in the postpartum area so that they can call a lactation consultant and can help you with breastfeeding and give you some tips that can really make a big difference. Now, once you go home, many hospitals have resource centers that also have lactation consultants available for you to talk to on the phone or even come in and visit. There are also lactation specialists. So for instance, in the Centers for Family Health where I work, we have a lactation specialist that we can have you see if you're having problems breastfeeding. There's also something called the Lactation League, which is a nonprofit organization that's there just for helping women breastfeed. So you can look them up on the internet and get their phone number, and they can give you free advice over the phone, or even sometimes make personal visits to help you breastfeed. So those are some resources to know about. And also, of course, if you're having problems, you can come and see your obstetrician or talk to your pediatrician. Both of the obstetricians and the pediatricians can give you some specific advice and tips about breastfeeding. So those are some resources for you if you're having a little bit of difficulty breastfeeding or you just need some extra help. Now, one of the things to think about with breastfeeding is positions, and there's a lot of different positions that you can use. There's the, what they call the football hold, where you hold the baby like a football and hold the baby on the breast, and that's a very common way to do it. Another way to do it is to cradle the baby in your arm and have the baby on the opposite side. So if you're holding the baby with your right arm, the baby will feed on the left breast, and vice versa with the left arm. So those are two probably the most common ways of holding a baby. Some people will also have the baby on their side on the bed, and they can lay on their side and have the baby breastfeed that way. And as you get better and better at it, you'll find more ways to breastfeed. I mean, it's possible to sit at the back of church and breastfeed and no one will even know what's happening, or walk in the mall with the baby, with a blanket over the baby's head, and no one will even realize what's going on. So there's all kinds of ways as you get better at it to breastfeed even in public and be very discreet about it. One of the key things about positions is that you want to make sure that you have as much of the nipple in the baby's mouth. Really, you want to get as much breast in the baby's mouth as possible, because if the baby only has the tip of the nipple in its mouth, that nipple is going to get sore. So that's a way to avoid some problems, is to try and get as much of the nipple in the baby's mouth as possible. The other thing is that after you're done breastfeeding, it's good to take a drop or two of the breast milk and let it dry on the breast. It's sort of a natural lubricant and helps keep the breast from getting dried out or infected. So those are also some little tips. Now, you're going to find that what you eat is going to affect the breast milk. And the interesting thing is each baby has its own taste. And so, for instance, with one of my children, if my wife ate broccoli, the baby was really mad because it didn't like the flavor of the breast milk. For other kids, it'll be different foods. And so you're going to have to experiment with that, and you'll find out what your baby likes and what your baby doesn't like, because the food that you eat can affect the flavor of the breast milk itself. And that's actually kind of one of the interesting things about breastfeeding. One of the common questions about breastfeeding is, what medications can I take while breastfeeding? And probably the biggest one that comes up is birth control. The truth is, there is no birth control method that is not safe with breastfeeding. In other words, when you're breastfeeding, you can use any birth control method you want, as long as you wait 6 weeks before you start that. So any of the birth control pills, the patch, the ring, the IUDs, the implant, all of those things are safe while you breastfeed. You just want to wait 6 weeks before you start it, and you won't have any problems. As far as other medications, in general, if the medication was safe in pregnancy, it's generally safe for breastfeeding as well. And so that's true with your cough and cold kind of medicines, Sudafed, Robitussin DM, Theraflu, the antihistamines are all safe in breastfeeding. Now, it is possible for the antihistamines to decrease the breast milk slightly, but for most women, this doesn't become a big issue as long as you drink enough fluids and stay well hydrated. One of the big differences about breastfeeding is that ibuprofen is safe when you're breastfeeding. It's a big no-no when you're pregnant, but ibuprofen is safe in breastfeeding. If you have questions about medications specifically, make sure you ask your doctor what medications are safe. Most of the antibiotics are safe in breastfeeding, but some are not. So you want to talk to your doctor about that if they start you on any medication.
Medtwice.com